This is so awesome. Good day, everybody. Welcome to Dental Voice with Zyrus. My name is Rolando Mia, and we have Dr. Mary Smith. We're really excited to spend time with her because she's going to talk about a courageous story. Purpose of Dental Voice is to hear directly from clinicians and understand the experiences, perspectives, and what they're dealing with on a regular basis. Dr. Mary Smith graduated from University of Missouri in Kansas City, and check this out. I'm going to let her do that, but she is starting her own practice. She acquired one and is starting one during a pandemic. So really excited to hear about it. Good morning, good day, Dr. Mary. How are you?
I'm okay. I'm good. I told you about my fear of public speaking, so
Oh no.
I'm nervous, but I'll be okay.
Oh well, I appreciate that you're joining us, and really, really, really happy that you're willing to do that. Thank you for that. So let's just get into it. So you finished from school, you started, take us kind of through how you got into dentistry, where you are, and then how you ended up starting your own practice.
Okay. So I always feel like I should have a better answer for how I got into dentistry, but I knew I wanted to do something in healthcare in college, and so I thought about medical school or nursing, and then I ended up not wanting to be in school quite so long with medical school and everything. I knew I wanted a family, so I just sort of picked dental. A neighbor was an oral surgeon, and so I shadowed him some, and I thought it was great, and I loved it, and so I just decided I'll go for dental school. And then I became a dentist, graduated in 2010. And I was talking to a dentist through dental school, keeping in touch with him and planned to work with him. Well, then months before graduation, he told me, actually, I sold my practice to Heartland Dental, but I still want you to come work with me. And so I did, and it turned out to be great. And I worked with him a couple of years, but I ended up opening a new practice for Heartland 2 years later. And then I have been there for years. But friends and family always kept asking, why don't you just go out on your own? You'll be great. You'll do it. And so I finally have decided to take the leap of faith. There's no better time than during a pandemic, I guess. So
wait, so you were with the largest DSO on the planet, incredible resources, all that type of stuff, and then you made a decision to go ahead and have your own practice. How did you do that? Did you buy one? Did you build one? What's the process around that? How did you kind of figure that out?
So I've been searching for a long time. And part of me, because I couldn't find a practice for about a year, I kept looking at different ones and they wouldn't quite work out. I was tempted to go out on my own and just build, but I decided against it just because St. Louis I'm from it's a pretty big city and there are a lot of dentists. It's pretty saturated. So it's better to I think it's better to purchase a practice. And so I ended up finding this one and it's been great. I think it's a really good opportunity.
Wow. Did you have help? How did you, it just seems, I couldn't even imagine what you'd need to do that. Also, and all joking aside, the pandemic is amazing. There are a lot of practices that are seriously considering either not opening or dentists exiting because of all the issues related to COVID and everything. And then here you are going, no, I'm going to go in there and I'm going to do it.
Yeah.
What was that like? How did you kind of overcome that, and
so
what helped?
Well, I think that part of the pandemic is part of the reason that I have this opportunity, because I'm purchasing from two female dentists, and they're great dentists and they really care about their patients. And one dentist of them was really ready to retire, and the other one wasn't. But then she had this time off during the pandemic and thought, I probably could wind down and just sell. So they decided to sell, and then I I'm taking the opportunity to buy it.
Holy cow. Well, first of all, congratulations. That's fantastic.
Thanks.
Have you opened, or when are you planning on?
No, 2 weeks. So I was ready to purchase a month or two ago, 2 months, well, a long time ago, but 2 months ago for sure. And then they really, I mean, it speaks volumes that they really care about their patients, and they wanted to come back from reopening and make sure they said goodbye to patients, and also transitioned me in. So I've been working there a couple of days a week and just meeting patients and trying to get to know the practice better.
Holy cow. So that's actually, think about that, a warm introduction into the dental practice, giving you kind of an insight into what's there, so that as you come in, it's not like, wait a minute, what happened to my dentist and who are you?
Right. Well, and the team too, it's so important because I think nobody loves change. And so I think that if I hadn't met them and spent some time with the team, they would have been more fearful of the transition.
Wow. Well, holy cow. Okay, so let me kind of focus here. In engaging and starting up the new practice, you're going to be basically the new dentist, and you're going to, are you going to keep the name of the practice? What's the logic, or kind of what's your approach for introducing this to the market and getting kind of the message out about what you do?
So it's really, it's a little unusual because the two female dentists that I'm purchasing from, they have always shared the space, but had two separate businesses and two separate practices. So I'm actually purchasing both of them and merging it into one. And so their practice names were just their full names. And so it didn't make sense for me to be Zora Hanko or Elizabeth Spataro. So I'm calling it Clayton Family Dental. The municipality that I'm in is Clayton, Missouri. And so I was shocked and happy that Clayton Family Dental was available. So that was good.
That is so awesome. And from a practice perspective, and from a kind of message to the community, what is it that you're going to be doing with the Clayton Family Dentistry?
I'm trying to think the message. I think the most important message to get out right now is just that even with the pandemic and the fear of COVID-19, it's really important to continue seeing a dentist and seeking care and preventative care and infection and poor dental health can actually make you more susceptible to the virus. And so at least my practice, I'm going to do everything I can to keep you safe. And I don't know, I care about my patients, so I want them to be safe, and I want to keep myself safe and my team safe. But you still have the dentist.
So is this one of your patients, Doc Thomas?
Oh, that's my husband. I think he's being goofy. I didn't.
Right on. Wait a minute, I can see that. Well, what's really cool is the pandemic has caused a lot of apprehension right now with people. And I mean, it's not just with patients, it's also, anxiety with teams. What's the feeling right now that you're seeing with your team members, and how are you what are your thoughts around navigating through that right now?
Everybody is different, and I think everybody has a different level of fear. So there are team members that are really fearful. And I want them to feel as comfortable as they can. So I would say that, any team member that's fearful should be able to come to their dentist and talk to them about anything. And I want my team to come to me because I want to know if there's something more I could be doing to keep patients safe. And I kind of forgot what the question was.
So it's no. There's teams a lot of teams are feeling anxiety because there's quite a bit of unknown with regard to the COVID pandemic. with regard to modes of infection. Slowly, we're getting more information. How are you reassuring them that, or are they not concerned? And if they are, how are you reassuring them with regard to how you're moving forward?
So I've tried to get a feel for that when I've spent time in the office, because I really don't know what it'll be like for sure. And most patients are just happy to be back. They, have said, I can't wait to get my teeth clean. I've been waiting and waiting to be able to get an appointment, that sort of thing. But I'm sure that there are the patients that aren't making the appointments and that are fearful. I would say one suggestion I have for my patients that are super fearful, I want to make sure that they know that they could call and request the first appointment of the day. And so that they know that overnight, nobody's been in the office until then. And so that might be the appointment for those patients to take, knowing that the office hasn't been exposed to a number of people. But even the people who come later in the day, we're going to be disinfecting and doing everything we can. I'm fortunate this office that I'm purchasing, I'm lucky it's not a real open floor plan. So I know that dentists are having to do a lot of even renovations to put up barriers between dental chairs. Yeah. And I'm lucky it doesn't, sometimes the nice flowing offices have two doorways in the treatment rooms where an assistant can go in, a dentist can go out. I don't have that, which doesn't seem like a great thing now, or it does now, but anyway, it only has one door and there's even a pocket door on it. So there's separate rooms for each operatory. And so that makes it a little more contained and I think would put patients at ease a little bit more.
Oh, that's so cool. And then, in this whole pandemic, the big issue is transmission. And the one thing that people keep going back and forth about we don't know much about our aerosols. What are you doing about those right now? And what are your thoughts on that?
That's the frustrating thing is that nobody really knows anything. So I think we just have to assume the worst and do everything we can to protect ourselves from it. But as you know, I'm purchasing isolites, which I think is a huge benefit to the practice. That's you can probably explain it better than me, but it's just suctioning from inside the mouth so that the aerosol and the splatter and everything doesn't ever leave the mouth and it gets suctioned right away from inside the mouth.
How did you pick that over? There are a lot of other things out there. Hood, and all that.
So I have experience using that before. And so even before all the COVID-19 worry and everything, I said I'm never practicing without this ever again, because it gives the dentist a peace of mind. It's like one less thing to worry about. You have to worry about instruments or something falling in their throat, and you also don't have to worry about the assistant holding the tongue back. There's even though the suction is connected to the same hose, you just don't get the same amount of suction out of the mouth the way that when an assistant's holding it, it's not the same as it being in the mouth and being still.
So, wow. So, yeah. In other words, if I understand correctly, the experience you've had with it is why you want to keep using the isolate.
Well, and then knowing, for sure, I may have not made the big investment right at the beginning and gotten all the operatories equipped with that had it not been for the pandemic. But I see the benefits because of COVID of going ahead and investing in it now rather than solely over time.
Oh, cool. What other systems have you all looked at with regard to keeping things safe, about aerosols, that type of stuff? Have you looked at other things?
I was trying to, because in my head it made a lot of sense. I keep seeing ads for these like foggers and smokers where it's actually like smoking out the room and disinfecting it. Because in my head I'm thinking that kind of makes sense, but then I can't really find the evidence behind it. So I don't know if I'm also like, everybody's going to be breathing that in. So I don't know if that's safe. So you just have to really, since nobody knows for sure, you just have to do what you think's best for your patient to keep them safe. And so that's what I'm doing. And isolete's a big part of that. And then obviously closing the treatment door and while they're having treatment done that's causing aerosol spray, and or wearing the face shield and 2 masks, and it's hot and it's okay.
Holy cow. So I just have to, do you know this doctor?
Oh, yes, I do. So she is, I just joined something called Smile Source, and she's my, I don't know, my
Administrator.
administrator. Thank you.
Ignore that part about feel free to give Rolando a lot of trouble.
So she got to know you too.
So wait a minute. Yeah, so that's kind of cool. So Smile Source. You know, I've learned that, you know, you're no longer part of a DSO. You chose to start your own practice.
Mm-hmm.
And I mean, even before you got in it, you've already committed to joining this organization. Why Smile Source? Why not something else? Curious.
So I saw the benefits of being part of a group practice, and I did have a great experience and I liked it. But so I feel like this is sort of a way for me to continue to have the benefits of something like Heartland, but without having but with being able to have all the ownership over my practice, and know that I can make decisions as I see fit, and you know, pay employees the way that I want to pay them, that I think they deserve to be paid, things like that.
So it's kind of the autonomy, but then you got resources behind it, it sounds like.
Yeah, and you have the camaraderie of other dentists, and I don't know, somebody to fall back on, I guess, if you get into something that you're not comfortable with, or things like that.
That's cool. How important is the connection to other clinicians out there for you personally?
Oh, it's always been really important. And I, you know, since graduating, I've kept in touch with dentists, and it's really cool. A friend in Arizona is opening a practice at the same time as me. And so I'm able to constantly be in contact with her. It's just, I've never been afraid to ask for help when I need it. And so in order to really improve and get better, I can't feel stupid asking questions that I don't know the answer to. And so having a good, close-knit group of friends that you can say anything to is so important.
Wow. If you were to, like, from the experience that you've had so far, and you're about to open your practice, if you were to highlight the top, call it 3 things that other clinicians really need to consider, that you feel are incredibly important if you decide to do this, what would those be when, you know, in figuring out or opening your own practice? Based on your experience, what are top 3 things you would tell them?
For somebody who's trying to go out on their own, you're saying?
Yeah.
I would encourage them to just do it. Ask different people, try to figure out, talk to people that are in similar situation to them, and then also talk to people that are in private practice. And I think that they'll see that that the people that have ownership over the practice truly like their job more, and I guess just ask a lot of questions is the biggest thing.
So number 1,
try to ask different people questions.
What would number 2 be? So after you ask all the questions, based on what you've learned, what else would you share for other people considering opening their own practices?
Let's see. I guess I'm saying ask questions again, but really find out as much information about the practice that you're interested in purchasing as you can. Spend as much time in the office as possible. and try to find, I think that my transition is going to be a lot easier because I think I have a lot of the same treatment philosophies as the dentists that I'm taking over. So try to find an office where if you're purchasing it from another dentist, find one that you can relate to and that you think will stick around afterwards to help, and that you'll have a good relationship with.
See, that sounds good. Is there anything that you would say absolutely, positively don't do?
I guess one of the things is don't try to purchase with another dentist unless you've worked with them in the past, because I think that partnerships can be hard, and even the associate and leading dentist can be tough. So maybe don't start with that, add it on later.
Oh, that's cool. So I love the idea of spending time in the practice to see if it feels right or it resonates with you, because I'm sure it's interesting because of the pandemic. If I understand correctly, there are a lot of practices now that are available. What's kind of your experience with that, and was it difficult to find the one that you were looking for, or did it just happen?
So it has been difficult because I've been looking for a long time, and that for a long time there weren't any available. And then I fell on to top of this one, and I just felt like, oh, I can see myself here. So I don't necessarily have a really great answer for that, but I have a better feeling about this one than one that I had previously sort of backed out of. So I'm eager to get started.
That is so cool. And the fact that you're already in the practice, basically, integrating yourself, I think that gives you a lot of insight into what's going on, gives you understanding of the team, and it introduces you to the patient. So that's pretty cool.
Yes.
So in the next 2 weeks, what are the things that you want to get ready, and how are you going to kind of kick this thing off, especially during a pandemic?
Actually, we happened to talk about that the other day. I'm kind of bummed that I can't have this big grand opening and a party and a way to introduce my team to everyone. And so I've got to be creative. And you even threw out the idea of doing a virtual open house and a virtual tour. So I may have to think up some things like that.
Yeah, that would be. I'll even join. I'll have to join just to see and say hi.
Yeah.
Oh, that's cool. Are there from a team perspective, are there things that you still are in flux that you still have to work out as you come in, or does the practice have the structure and kind of the format that you're happy with already?
It's tricky. I'm trying. So no team members have left, or at least they haven't told me that they're going to leave. So yay. But it's a little bit tricky because it was a 2 practice office, and now we're merging it to 1. And so fortunately, each dentist only had 1 assistant, and I've always worked with at least 2. So we're going to both be working with, so both assistants will be working with me. One thing for the COVID is I plan to kind of have a COVID officer, or I don't know what I'll call it, but somebody who's just sort of in charge of making sure that the office is following all protocols for that. So each employee might have some different responsibilities than they're used to, but it should be easy because they know where things are and I don't, and they know probably more about the office space than I do. So it'll be nice to have those employees.
That is so cool. So if you were to sit down and if you could speak directly to your team about opening and then the future as a new entity, as the Clayton Family Dental and COVID, what's the message that you'd want to give them with regard to what's going to happen here and how you intend to move it forward? What are some thoughts around that?
I guess I would just tell them that I hope that they're sharing in the excitement of this with me. And just like so many things in dentistry, to always stay patient focused. If I can keep the best interest of patients as my biggest focus, including keeping them safe with COVID, then I think we'll be successful. And so just to be genuine and try your best at making patients feel comfortable and good, and trying to
No, go ahead, keep going.
oh, and we'll just fix whatever comes in front of us, and get to know our patients well, and care about them.
That's awesome. And then as far as the message, what message would you want to give to your patients, and what's kind of the sentiment that you want to get across to them, those ones who would be seeing this or who are going to be engaging with you?
So I always try to encourage open conversation with patients. I tell them, don't worry about being rude, or just tell me anything you want, anything you're feeling, because if I'm just guessing how the patient's feeling, then I feel like I can't treat them as well as if I just knew. So I try to encourage open conversation. I don't, if they're hesitant about a treatment, it's great when the patient comes in and says, I want to do that, but it's way too expensive and I think it's a ripoff. That would make me feel, that makes me know how to talk to the patient and let them see the value in what I'm doing for them. But if they just say no, I don't know if it's because they're fearful, or I don't know if the cost is holding them up, or what's happening. So I just try to encourage patients to always tell me anything.
So be open, be direct. It's okay if you don't agree. It's
Mm-hmm.
about communicating. It's about making sure that you understand and everything's going fine.
And then also them knowing that I want to do everything I can to help them.
That is so cool. Well, the fact that you've taken the leap of faith, the fact that you've decided, okay, COVID or not, I'm going to do this, and you're about to start, I think that's absolutely, absolutely wonderful. If people wanted to reach out to you or ask you questions about what you're doing, or kind of share, what would be the best way for them to reach you?
By email, or just calling, I guess. That's been so important. It is important, especially for younger dentists, to have someone older that they can contact and ask questions to. I can't believe I'm an older dentist now. I have been doing it 10 years now, though. I guess I'm an old dentist. But to have someone who has more dental experience than them, that they can, if you run into things, you always think, oh, I'll look it up later, or I'll find out tonight after work or something, and that never ends up quite happening because 100 things happen in between. And so if you have an old dentist like me that you can just text or send a quick email to and get it responded to, then you'll learn so much more than if you try to do everything on your own.
And what's the best contact information for them to get to you?
So like my email address?
Yeah.
So I have Dr. Mary at theclaytondentist.com. That's probably the best way.
And what's the website for your practice? It's
still being created, which is exciting, but it is www.theclaytondentist.com.
www.theclaytondentist.com, and that'll be up soon, and you're going to be opening a practice soon, and holy cow.
Yes.
This is awesome. First of all, I want to congratulate you on doing this. I'm really looking forward to watching you grow and succeed and all that type of stuff. Several months from now, when you're crazier than ever because you're so busy and you're doing really well, would you be willing, or otherwise, would you be willing to join us again and share what's happened as you've opened your practice, as you've overcome some of the things that you thought you knew or you didn't know, that type of stuff? Would you be open to do that again?
Sure, Rolando, you're always fun to talk to.
Well, I so appreciate you taking the time. We appreciate that you're willing to talk. You did share with me that, you know, public speaking is something that's not the most comfortable for you, and you're absolutely wonderful. And I think the kind of the message got across, which is it's about the patients, it's about the team, and that's really cool. Any closing comments or anything additional before we go here?
Not that I can think of.
Well, thank you for joining us. Hey, everybody, if you like this, if you have any questions for Dr. Mary Smith, please reach out to her. Really looking forward to seeing the Clayton grow and thrive. I think it'll be a really cool thing to experience. If you like the content of this, please share. If you have any questions, please reach out to Dr. Mary. Well done. I'm not gonna jinx it, but I'm really looking forward to when you open, and send me the invitation so that I can come join you. I'd love to see what you're doing. So cool.
Thank you for inviting me to speak with you. It's been fun.
Awesome. Have a great rest of your week. Please be safe. And then maybe later on we can talk about your bird. I think you have a bird.
Yeah. I'll put him upstairs so he's not squawking the whole time. Yeah.
All right. Have a great rest of your week. Thank you so much. Appreciate it.
Thanks.
Bye.